It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Hello, my beautiful people. Thank you for joining me with another episode on Spill With Me, Jenny D podcast. This is brought to you by Clair Health. I would like to thank them for bringing awareness for Breast Cancer Awareness Month in October. And I am just so delighted and excited to have my guest today. I have Shawndel. Shawndel, thank you for joining me today.
Oh, thank you so much for having me. I am excited to share my story with all of your listeners and raise some awareness on the importance of getting a screening mammogram every year.
Right. And, you know, when I talked to St. Clair Health, we were like, you know what, we really need to have an episode where we have a survivor on. And talking about your experience and what you went through, because we always say, you know, October is Breast Cancer Awareness Month, but every month should be Breast Cancer Awareness Month, right?
I sat up a little taller when you said survivor.
I know.
Because sometimes you forget, right?
I know. Shawndel,
that anniversary is coming up right around the corner.
It's coming up, and I'm just so thankful that you're here to tell my listeners and viewers about your story, because I think that there's a lot of misconceptions. Mm-hmm. So bring us back. How old were you when you started to get your mammogram?
I started getting my mammograms when I was 40. I do have a family history of breast cancer. The family history on my side is with my grandmother, but my doctors felt that her breast cancer was more environmental than genetic.
Really? Like, how many years ago was that? Environmental?
My grandma was in her 60s, and she lived in a small town in southwestern Pennsylvania.
Okay.
And there were 3 people that shared a water source. And each family had someone with breast cancer. There were some pesticides. No, I'm not kidding
because I am starting to really think that the environment
has something to do with
a lot of us getting breast cancer.
Yeah.
Oh, so she was diagnosed at 60, in her 60s.
In her 60s, yeah.
Okay.
Yeah.
So then your doctor thought, okay, you need to go in your 40s.
40s is fine, because I did ask, with this family history, should I go sooner? Should I start at 35? And based on, you know, our story, our family history, no, 40 is fine for you. So I started in my 40s. I'm now 51.
Hey, I'm 52.
Right. I don't feel a day over 50.
That's right, baby. It's my Botox in it. But no, I started 38 because I have it on, it's my mother's sister, and it's also my dad's sister.
Got it. Okay.
So, and they were diagnosed like in their 50s.
Yeah.
So I don't know if it's the age and then we always talk about, well, if it's no family history, then you don't have to get a mammogram. But Shawndel, you're in the health field.
Yeah.
So tell us why it's so important.
Oh my goodness. Early detection. Early detection makes all the difference in your treatment, in your diagnosis. The sooner that you get things taken care of, the better it is for your overall health and well-being of yourself, your family, everybody who takes care of you. Early detection is key.
So tell us about the first time that you got your mammogram, and I'll tell you how my experience too. Tell us, what did you expect, or how did you know about it because you're in the health field?
I knew. I mean, no one really prepares you for it, right? Standing there, you know, uncovered.
Right.
The machine.
But I felt so comfortable because
oh my gosh, the technician,
yes, because they do it every how many
day.
I think they were saying like almost 200 people they see sometimes a day.
Yeah.
And they're doing these mammograms. So, you know, you feel uncomfortable, but why?
Yeah. They're so kind, so caring.
Yes. And I get mine done at the St. Clair
I do too, as well.
Oxford Center. That one. I was telling Aaron a couple weeks ago, I was like, I feel like I'm at a spa because it's very relaxing there.
What, with the waterfall?
Yes. Yeah. With the waterfall, right? And I feel at ease because, you know, I mean, early detection is so important.
Yes.
I don't know, I know a lot of women are feeling, oh, I don't want to get my, literally, how long does it take?
Oh, the mammogram itself, 15 minutes tops, if that.
Right.
Probably less. 15 minutes from the time you go back, you change your clothes, you go in.
Exactly.
Yeah.
Exactly.
Then you wait a little bit. Someone talks to you.
Yeah, right.
Yeah.
And it's so you started getting mammograms at 40, and then you went once a year.
Once a year.
And how many years was it till you?
From 51 now, and it was 2 years.
Yeah, we're doing the math.
We're
here,
doing
people.
math. Yeah, bear with me.
Don't ask me.
It was probably 8 to 9 mammograms before this one where they said you need to come back.
But let me ask you this: like, I felt, as I get older, because I have a very extreme dense breast. Do you
Yes,
have that
I have
too?
dense.
Okay. So I was seeing that there was something on TV talking about how now they're going to do extra screening or extra imaging with the ultrasound and things like the 3D because it's hard to tell.
Yeah.
So when you went back 2 years ago and you went for your annual mammogram, la la la, just another day, and you had it at the St. Clair Health.
I did.
What did they say anything when you were there? Like, hey, we see something? Or
They did. They wanted me to come back for an ultrasound, and then after the ultrasound, they had asked if we want to biopsy this.
Okay, so they found. Now, where did they find it? Did you
In the
feel
right.
anything?
I felt nothing, and I go yearly for your gynecology exams, your breast exams.
Right.
Apparently, it was tiny. It's very, very tiny.
So you wouldn't. It was on the right side.
Yeah, it's on the right side. It's not good.
I
I even know where it is.
We're like,
what's told?
I know.
Yeah.
And so a couple weeks ago, this was in August, I had my mammogram, my usual mammogram, like we were just saying. And they said, I get this letter. Well, my doctor sends me and says, you have a mass on your right side. Well, I thought, that's it.
That's
I
it.
have
It's
it.
done. It's
I'm
over.
done. I have breast cancer.
Formulating a plan in my head.
Right. Yes. You're like, okay, there I go. I get my bucket list out. Yeah. I mean, you just you think the worst.
You do.
Because you're like the word mass.
Yeah.
So what did they say to you when they saw? They said, oh, we see something that we need to biopsy.
I just kind of took it in stride. It's going to be fine. I tend to see, the glass half full, right?
Yes.
So we don't know until we know,
Right.
right? So I sort of kind of kept everything a little private. Figured there was no reason to tell anybody until I needed to tell anybody. I do have a family of warriors, so
Yes,
I figured it was
I
best
do too.
to kind of keep that there. So then had the biopsy done, and now in this day and age, your health records are online, right? The minute you have something done,
That's true.
Yeah, your doctor's automatic. Did you?
Yes.
I was driving to meet friends for dinner.
Okay.
And I remember exactly where I was at the light at Heidelberg and driving
you did.
on, and I saw a phone call from St. Clair as my obstetrician, and he said to me, I imagine you already saw your results. And I said, no.
Oh, no.
Because I didn't look first,
Right.
right? And I think everybody does look first, but I need to be told. And so it was, okay.
And
at least.
what did he say?
He said it came back positive for,
Cancer.
yeah, invasive ductal
And
carcinoma.
you're driving.
And I'm
okay.
driving
That
to dinner.
me, right there. You're driving and you find this out.
Yeah.
And it is, like, what did he say? Did he say, well, you need to come in for testing? Or you're like, okay, what do I do?
At that point, it was no longer testing. It was, you need to see a surgeon. So he gave me a surgeon's name and number there in the car.
Oh, my gosh.
But I just kind of it was good that I was meeting friends, because the minute you walk into that restaurant in that space and you see those friendly faces, right? So actually, I had 2 friends who knew before my family.
Oh, no.
But it was fantastic. They were great. And one of my friends who was there is actually a nurse here at St. Clair Hospital. She works in the OR, and she says, I am going to take care of you.
Oh,
And
God bless.
Yeah. She came in on a day off to do my surgery with the team, which was totally amazing. Yeah.
So a week later, you came in.
Yeah.
and they did the surgery right away?
No, the surgery wasn't done. There were still other
how
things.
did they prepare you? Because I
No.
feel like everybody's journey is different with breast cancer. So tell us, did you have to go through chemo?
I only had to do radiation.
Oh.
Thank goodness. It was
Really?
awesome.
Because it was so small.
It was so small. They took that part out. So I had a partial mastectomy or a lumpectomy, I think is what they used to call it, on my right side. They took some lymph nodes as well, but I saw Dr. Ahmad here at St. Clair, and I went in for her visit, and I had all of my questions, and I had my paper and my notebook, and she was just like, nope, you're going to put that down, and I'm going to write down everything for you.
Oh.
She had a picture of my breast, exactly where everything was.
Oh my gosh.
Everything written out exactly step by step what her recommendations are, because at that point, I'm in my 50s.
Yes.
I'm thinking, or 49 at the time. Just take it, right?
Right.
She's
Just
like,
get
if
it
I
out.
thought for 1 minute that we needed to take everything, I would take everything.
Right.
But we don't. I think this is going to be
You
what
caught
we
it
need.
in time.
Yes.
Right.
Yes, because of early screening.
Yes.
Which is the key to it all.
How big was it, Shawndel?
It's a 0.5 centimeter.
So what is that like? Look like a pea size?
Probably, yeah.
Wow.
Yeah.
So if you wouldn't have,
I know, right? And I've tried, even after I tried.
Right. I mean, like if you wouldn't
Right.
have went and got that mammogram,
Who
it
knows?
gets larger and larger, right? So that's what. Okay.
Yeah.
So when she's like kept you at ease and
At ease the whole time.
that's what you want from
Yeah.
a doctor. Like that's
And
what you
I
want.
thought for a minute, no, I want to write it down. Every question I asked, she wrote on that paper with the pictures, with everything else. Every little bit of information that I needed to have, I left there with. I did not need my notebook, not one tiny little bit. She was amazing.
You felt so at ease. Like
I did.
You knew you were being
really,
taken care of.
really did. Yes.
So she said, all right, we're going to do radiation. So did you do radiation first?
No, after. You have the surgery first. They took out, I guess, the mass, the lump, the tiny little pea size.
How did you feel after the surgery?
Relieved.
But I mean, did you
Like-
were you achy or did you feel like any pain or anything?
I like to think I have a pretty high pain tolerance.
Yeah.
Right? I'm totally invincible.
That's right. She's Superwoman.
I
here.
really am.
Wonder Woman.
So I felt really good. I felt good after the surgery. A little bit of, aches and pains, but I've never had surgery before, right? Outside of I had one baby, right? That was the only other time I've been in the hospital was to have a baby. I've been so lucky as far as health and so it was the only time that I had ever had surgery. It was outpatient. So my daughter, who was 18, 19 at the time, she was my driver, my rock, my stand by me person. But the great thing about a smaller community hospital is you know people, right? You know people that are here.
And people know people. So when you're looking for...
Knows. Someone I went to high school with was there in the pre-op area. Oh my goodness. And she was like, I don't know if you want me here, but I just want it. And I'm like, oh my gosh, please stay, hold my hands.
That warms my heart.
It's amazing. It's
the
amazing.
support you get, the community of support, especially at St. Clair Health. Like I feel like that's why I'm like, all my doctors are from here. I've been,
I couldn't imagine going anywhere else.
No, and I had my babies here.
Yep.
I just feel like that I'm getting the best care.
Yeah.
And the knowledge that they have, and they're not going to let you slip by. That, just real quick about my... I went and got an MRI because they did see, a mass, and they weren't sure what it was. So when I went for the MRI, I was nervous.
Yeah.
I documented it. I'm going to put it on air so people can see it. And Erin was along with me, and I was like, what if here I am documenting. What if they tell me that it is cancer and it's not benign? Now, thank God it is benign.
Right.
But we'll go through all those results in the future. But after surgery, they didn't say anything right then and there. They're like, okay, did we get it all? Or
the thing with surgery, so Dr. Ahmad was my physician. She was supposed to be doing my surgery. She had a emergency herself.
What?
So her partner, Dr. Budway, came in and stepped up and did my surgery because I had already had those radioactive seeds that they use for surgery.
Oh, I don't know about those. What is that?
So
See, look, I'm not in the healthcare or health field, and my mother is. So tell us a little bit about what that is.
So before you go in for surgery, there are seeds that they place that helps them locate the area where they're going to take that tissue out.
Okay.
So I had my surgery was scheduled for Tuesday. I had the seed placement the Friday before. So I already have these, and you can still hug your family, and it wasn't, you didn't have to worry.
Did it a little bit?
Again, maybe, but they numb you up.
Right.
They're fantastic, right? So you've got these. They're in. They can't stay in. Right. So since I was already placed, we had to proceed with surgery. So Dr. Ahmad, her partner, Dr. Budway, who I don't know if anybody out there knows Dr. Budway, but that's kind of a well-known name of someone who's going to take amazing care of you. So I felt, even though Dr. Ahmad couldn't be there, I felt like I
was
were
in good hands. Yeah, absolutely.
Yeah, such great hands. So she did the surgery. After surgery, we feel like we got it. We feel like your margins are clean, but, we have to wait for pathology and things to come back.
How long was the surgery?
Oh, that's a good thing about surgery. You have no idea, right?
I guess right? That's true. That is true.
I couldn't remember it all. My daughter could probably tell you better, but it wasn't there all day. It was outpatient, right?
Okay, so
I
maybe like a couple hours. Yeah, but by the time they prep you and get you...
But again, working at St. Clair, and there were faces that I knew absolutely everywhere. And knowing that I had such a great team who was...
They're like, you got this.
You've got this. We've got you.
Yes.
Yeah. But even though I work here, that's the same care that they would give to anybody.
Yes.
Because it's just an excellent place that...
That's what you want.
Yeah.
I mean, because...
it's like a family.
When you're in the health field, don't you think, and I thank you, because you have such a big heart. I always think of my mom's a nurse. She used to work in hospice. Like, I feel like the people that are in healthcare, we don't thank them enough for what they do, what they see, and
every day.
And I'm such an empath that I'd be crying all the time with people. I'm a crier. I am a crier. But
I save all my crying for the car where no one can see
I
me.
know, right? Yes, right.
Half of the day is over.
Yeah. So when you came out of surgery, so your daughter took you home. And how was when did you find out? How many days later?
I say probably roughly around 7 days to get the final. Yeah.
How were you feeling those 7 days?
I was feeling great. It was right around Thanksgiving, right?
Okay. Yeah. So you were
I got out of making any parts of dinner.
Hey, I just had surgery.
I can't do any parts of it. No, I'm going to stay here and let my daughter take care of me. That's when I told her how to make turkey dinner, right? So it was a learning moment for her as well. But yeah, it was good.
So you got a call, or did you see something online?
No, I got a call. I don't see. I'm that person that ignorance is bliss. I not
like the
look.
Call. Yeah.
I like the call too, because I like to hear and
when you read it.
Ask
that's
questions.
When I read mass. I was like, mass on the right side. Oh my God, it's a mass. You think of a mass is huge, you know. Meanwhile, it's probably, like you said, it's like a pea size.
What did they say? And they called mine spiculated. So then I had to Google that word. It means little spikes on it. I was like,
oh my gosh,
what's happening here? Right.
But it's gone. Don't Google it.
Right. Don't ever do that. Right. But we're all guilty of it. We all do it.
So you got that call. What day was that?
So right after early December.
Okay.
Early December. So then they tell you about your next steps. So my next steps were to see radiation oncology and medical oncology.
Okay.
I am not quite in menopause yet, and the kind of cancer that I had really likes estrogen. And I still get a regular period.
Right.
So I had to go on tamoxifen. So I had to see medical oncology for the management of that.
What is tamoxifen?
Tamoxifen blocks estrogen to your breast.
Oh, okay. This is something I'm learning. I don't
it's a medication that is an estrogen blocker.
It's a blocker.
A blocker.
Okay.
Yeah. So
and
my
that's what
particular
you need after you right before you get into radiation. Is that what that is for?
I had radiation first, and then we started with the tamoxifen. So I'll be on tamoxifen, maybe for the next 5 years, or
Okay.
if I decide to go into menopause before that.
I know. If you never
The
know what your
mystery
body
of menopause, but
Right.
that's probably a topic for another
Oh,
podcast.
yes. We definitely have to tackle that one because I'm definitely in menopause.
Right.
But I think that's why
Yeah.
I might have had that mass because I am in menopause. And there's kind of like weird things happening, with your body.
Yeah.
So they may see something. But thank you, Clair Health, for getting that extra testing, for having me go get my MRI. It's just
They're
like...
so astute in making sure that they take care of everybody to the best of their ability.
And they're not like, hey, they're going to get money for you to go get an MRI. No, they're doing it because they care, and they were like, hey, listen, we need a little bit more, imaging or with the scanning to see if there's something really there. It's amazing.
Yeah.
And it was only like a half an hour.
Right.
The MRI. You never had to get an MRI.
I did.
Oh, you did?
Yeah.
Okay, through the process. So
Through the process,
Yes,
MRIs, stereotactic biopsies,
Ooh.
all kinds of fun things.
Yes. Oh, yes.
But I would say through all of it, pain level,
You have such
minuscule,
a great,
right?
like your aura and your personality, Shawndel, I want you to be there for me.
Oh, sure.
I mean, seriously, you are like, I
Just
just...
wait in the waiting room for when you
You're
come back.
affectionate.
How'd you do?
You're like, I feel like, oh my gosh, like she's like, I feel like I've
See?
known you forever.
That's why my labor and delivery patients really like me too.
Yes, they
I was a really good coach.
Oh, you are just a bright of sunshine
Thank
for
you.
people that are just the unknown. I think
Yeah.
is what really scares people.
Yeah. Yeah.
So in December, when you had all those results, and then you went through radiation, and then you started taking. When did you have to go? Did you have to keep going back to get your mammograms again?
Oh, I still have to. Yes,
Okay.
every 6 months.
Every 6
Though this year is coming up on year 2. I just had all of my screening done in September, and I have graduated from the 6-month mammograms to the year mammogram.
My daughter's in theater. You have to snap.
Yeah. Oh, is that what we do now? I'm not that hip. I didn't know we snapped, but yeah.
See, look, I'm
it was
teaching
awesome.
Shawndel
It was awesome. Yeah. It was great news.
Excited
I
for
texted
you.
every family member in the car. I've graduated.
Oh,
I'm on the year plan now. So yeah.
I am so excited
Yeah,
for you.
me
hon.
too.
I mean, what
Me
a
too.
journey.
Yeah.
I mean, could you give advice to anyone who may have been diagnosed recently, or that is just really hesitant about even getting the mammogram?
Oh, you have to go. You have to get the mammogram.
Yeah.
The earlier you are treated, the faster interventions can be made. They can find out exactly what kind of cancer you have. There are different kinds,
Right.
different treatments, and the sooner you go, the better you will be off as far as your health, as far as
I just
recovery.
yes.
Screening mammograms are key. Don't miss any of them.
Right, I know,
Yeah.
and I had a cousin who is a nurse, and she had triple negative breast cancer. Scared the crap out of us.
Yeah.
Now she is,
As it should,
yes,
right?
Yeah, but she's
gotta
doing
get-
very good now. She did find a lump. She's doing very good, and I think that's what people are like. Oh, well, you know what? I don't feel a lump, so I'm good, and I don't have any family history, so I'm good. I mean, what do you say to them?
You have to.
Right.
You
It doesn't
absolutely
matter
have
if
to.
you
It
have
doesn't
family
matter,
history.
right? Did my grandmother have a family history when she went for her?
That's
Think
true.
about
How
it.
would
And
they
that
even
was
know?
how many years ago, right?
That is so true.
Right. And she's in her 90s now, doing amazing.
Oh my
Yeah.
gosh!
Yeah.
God bless. I'm so happy to hear that.
Those are like
Aw.
96.
Wow.
Right. Yeah, so I have a good...
You got good genes,
I do.
girl.
I've got good genes, and got to take care of those
Yes.
with all of your screening mammograms for
Right.
everybody.
Yeah, I mean it's only once a year now. I know, and Clair Health also offered free mammogram screenings.
Yeah.
I think this was last week or a couple weeks ago, but I don't know if they do that often. We'll have to talk to Erin about that, if they do it once a year or a couple times.
Yeah.
Because it really helps people know what to expect.
Yeah.
And to say, you know what, let me try it if it's free. Because a lot of health insurances do cover. Yes, they cover mammograms.
Yes.
So that's a
The
good thing.
screening mammograms are just, I can't say enough. Go every year.
Right.
Yeah.
You know, I think about, a lot of people in life that, we always think, oh, well, men are not going to get breast cancer.
No, they can too.
And do men get mammograms?
They would need to if there was something abnormal.
Right, because
Yeah.
they'd be able to feel or notice
Yeah.
a little bit more than we would, because
That's why those visits to your primary care physician,
Right.
male, female, those healthy visits that you should get on a yearly basis should not be missed.
And that's the hardest thing. Now, has your perspective changed on health and wellness?
Oh, yeah.
I was going to say, tell us a little bit about that.
I've never been great about diet and exercise. But after this, we went out and bought a treadmill, and there's not a day that goes by that I'm not on there for at least a half a mile, 15 minutes, an entire mile, right? Like, just, you have to stay healthy. And for me, just hearing that diagnosis of cancer, right? Who's going to be there for my daughter? I'm a single mom. She's all I have. Right. I've got to be here. So, yeah, spend that extra time, walk every day, make better food choices.
Yes, I know.
As hard as it is, and I don't know, I'll just always say, listen to your mom. My mom is that kind of mom. This vitamin does that, and I look this up, and this one does that, and then I double check her to make sure, right. that it's factual, and she's usually pretty spot on. So it's vitamins. I will see my primary care physician, my obstetrician, medical oncology. This past year, I graduated. I don't have to see radiation oncology anymore. We're done.
Wow,
Yeah.
So was it a lot of doctors' visits?
It was a lot of doctor's visits for a short window of time. I had to do 20 targeted radiation sessions, and they will map those out for you.
But you still worked. I know we talked about this off air. She still worked. Do you recommend to stay busy?
That works for me.
For you.
Right? But radiation can be really taxing for some. You can get tired and feel achy. And for me, the biggest part was skin changes because it started to break down from the radiation. But for me, I feel confident that I was able to work. I felt well enough to work. And I definitely do like to be busy.
Did the radiation make you tired then?
I think it does for some, but for me, I did okay.
Yeah.
If I thought for 1 minute that I needed to rest, I would. But I don't know. It's probably better for me to kind of keep my mind going and. Yeah.
I know my cousin, when she was diagnosed with triple negative, she went back to work too.
Yeah.
Because it's everybody's different, and she was tired, but she knew that she had to keep her mind off of it. And now to be able to talk about it, Shawndel, and to let people know like your journey, what happened to you and how you're dealing with it, like that to me is going to help somebody else out there that feels that they're alone in this process. Yeah. Did you ever feel alone?
Oh my gosh, from the minute it came out, social media sometimes, But I had people reach out. Hey, listen, I heard this. I've done this. I'm here for you, right? Just to be able to talk through the process to somebody else who's been through it, because there weren't a lot of people in my family who had been through it. Grandma, but that was decades ago, right? So it was good to know. I joined a support group online, Pittsburgh Girls with Cancer.
That's so nice.
And, you can ask questions. I love this doctor. I love this, care facility. They would talk about different places to go if you needed chemo or if you needed this doctor or that doctor or bra fittings.
I love that.
It was,
See, to me, like that support system, you need that.
You need it.
We're in this together. Like if we don't talk about it and we don't help each other, and if we know things, or, hey, listen, if you're having problems with this is what you need to do. Yeah. That's what it's about.
That's what it's about.
I mean, I thank you so much. I mean, seriously, you are, like, your attitude now, I mean, this October with the pink and stuff, it's a reminder to some women.
But sometimes I do, because I think I did so well, sometimes I block that part out and I forget. And it was when Erin gave me a call about this, I looked at my calendar and I was like, oh my gosh, October 13th is 2 years of being free and clear. And
oh my gosh.
Yeah, it feels good. This feels really good.
The timing is perfect.
It is perfect. It is.
I could just see, like, the happiness in your eyes.
I do feel thankful every day. As much as I try not to think about it or dwell on it, it did happen. Got little scars to prove it.
Yes.
But for the most part,
nothing changed on you with the radiation? Because a lot of people get nervous about radiation.
Radiation, there were again, the skin changes and the breakdown during radiation was a little tough, but I listened to everything they said. Aquaphor, Aquaphor, Aquaphor is all I can say.
Oh, wow.
And after the fact, there was some discoloration, but again, keeping that skin hydrated, looks minimal now, right? Yeah.
I think what's so scary is when I did the podcast episode with the technicians from St. Clair Health in Oxford Center, I was floored when they said 1 out of 8.
I know, right?
And I asked them the question because I want to know. I'm like, why? Yeah. Why is it 1 out of 8 now? Like, I feel like, in a couple of years it's going to be 1 out of 5. Like, it makes me nervous. And that's why I think that we have to emphasize, get your screening.
Every day, yeah.
1 out of 8? I mean, you could be in a restaurant and you look at all the people in there and there's going to be, it's terrible to say, but people are going to be diagnosed with breast cancer in their lifetime. It's just, it's a scary thing to say. And I just, I thank you so much for being open and honest about your journey. And
it was a good journey. It was a journey, but the support and everybody I had around me was,
So for someone to get a screening, what number would they call to get a hold of like St. Clair Health? Would they just call the number, the one that's 412? What is it?
Absolutely. You can call 412-942-7800, or you can visit stclair.org/breastcare to schedule your screening appointment with the breast care center.
Perfect. Thank you so much.
Oh, thanks for having me. I enjoyed being here.
I enjoy getting to know you, and I'm telling you, your spirit and just your attitude. And I think that if you have that positive attitude,
it makes all the difference.
It makes all the difference. And we thank you so much for joining us with this episode. Yeah. It's October Breast Cancer Awareness Month, and I want to thank St. Clair Health for just being there. This is brought to you by them, and I appreciate them bringing this awareness into everybody's lives and homes. So make sure to get that screening.
Get it every year.
Yes.
Thank you so much for having me.
Thank you, honey.
Yeah, thank you.
This was another episode of Spill with me, Jenny D. Take care.
Come spill with me. Come spill with me. Come spill with me.